Well, the House of Representatives could vote as early as tomorrow to reopen the federal government, as we are now 6 weeks into the government shutdown.
Meanwhile, Americans on the Affordable Care Act could see their monthly premiums for health insurance increase dramatically if the tax credits that are set to expire at the end of the year are not renewed. News for Tucson's political specialist Eric Fink spoke with one Tucsonan who's feeling the pinch and looking at a big jump in her health insurance costs.
When the Senate voted to reopen the government, 8 Democrats crossed over to join Republicans. Both Arizona Senators Mark Kelly and Ruben Gallego voted no because they say the deal doesn't firmly address rising health care costs for many Arizonans. I spoke to a woman who's self-employed. She's on the Affordable Care Act, and she says if something doesn't change, she'll have to move things around to afford her health care.
I pay $731 a month right now, and if I stay on the same plan, which really is a catastrophic plan at this point, it will go up to $1,083 and change as of January 1.
Adina Hope Bank has been in Tucson 35 years. This licensed clinical social worker is one of more than 400,000 Arizonans on the Affordable Care Act. As she faces a potential jump in premiums, she considers herself lucky.
I make enough money, I will get insurance, but I know there are people who have to make the decision whether they're going to actually get insurance or not.
Dr. Dan Dirksen is a professor in public health at the U of A. He's also a family medicine doctor.
By my analysis of the 423,000 who are currently enrolled, Arizona could see a decrease in enrollment of 125 to 150,000 individuals losing their coverage because they can no longer afford the copays and deductibles.
8 Senate Democrats voted with the GOP for the deal to reopen the government. Part of that deal, a vote in the Senate next month on extending the Affordable Care Act subsidies that run out at the end of the year. But House Speaker Mike Johnson won't commit to a health care vote in the House.
We're going to do in the House what we always do, and that is a deliberative process. I mean, we have to find consensus on whatever their proposal is.
3 weeks ago, Republican Congressman Juan Ciscomani joined House GOP colleagues in sending this letter to the Speaker, saying the House must take up health care once the shutdown ends. That letter reads in part, quote, "We should immediately turn our focus to the growing crisis of health care affordability and the looming expiration of the Enhanced Affordable Care Act premium tax credits. Millions of Americans are facing drastic premium increases due to short-sighted Democratic policymaking. While we did not create this crisis, we now have both the responsibility and the opportunity to address it. Allowing these tax credits to lapse without a clear path forward would risk real harm to those we represent." But this provides little comfort for Bank.
I feel angry. I feel afraid. For me, a small proprietor to be wedged like this is absolutely not acceptable, and we are not taken care of.
And Bank says she will talk to her insurance agent about finding a plan off the marketplace to see if there are other plans that are more affordable. She says the problem with that is many of those other plans have caps, and she says if she faces an emergency, she could possibly set herself up for medical bankruptcy. I'm Eric Fink, News 4, Tucson.